The impact of this wave on our health system is already worse than any of the 3 waves that came before. This crisis impacts all of us. The integrity of the healthcare system is essential to delivering urgent and non-urgent care to those who need it most. AHS has taken steps to increase capacity to care for those who need it, but that is just one piece of the puzzle. It is equally vital that we reduce the rate at which COVID is spreading across the province. I know this is difficult. Albertans are not alone in having had to bear unbearable burdens during this time of COVID. In every country around the world, COVID has waxed and waned in different ways, taking lives and livelihoods, as all of us have struggled to find a balance between COVID's direct and indirect impacts. However, the challenge we face right now is uniquely severe in the context of Alberta's last 19 months, and our response must meet the challenge. To ask Albertans yet again to step up to protect each other through activity restrictions after all we have been through is agonizing, and yet it is absolutely necessary. Our hospitals cannot sustain care for all Albertans with the dramatic and rapid increase of COVID patients that we are seeing. Although vaccines are highly protective, the Delta variant is extremely infectious. I want to be crystal clear, the majority of COVID patients in hospital across the province are not vaccinated. However, we are also seeing some double vaccinated individuals who are vulnerable or immune compromised who are still getting COVID after 2 vaccines, and sadly some are still dying. We are offering a 3rd booster to many of these populations, but protecting those who may not have a full vaccine response is yet another reason for otherwise healthy people to choose to be fully immunized to protect their community. I want to stress that no single sector or area of our society is driving this spread alone. Instead, it is the result of close contact that occurs whenever people gather together, especially indoors. This means no one sector is to blame, and it also means that we have no choice but to include many different areas where people can and do interact in ways that increase transmission. Each of these new measures acts as a layer to help stop transmission. They are meant to work together to reduce the risk of COVID-19 and to bend down the curve again. We saw in past waves that a layered approach across multiple sectors can bend down the curve. I know that restaurants, gyms, faith communities, and others have worked incredibly hard to protect those they serve. I wish these steps were not necessary, but they are. I cannot speak strongly enough about how important it is that we all follow these measures, and for each of us to consider how we can reduce in-person contacts with people outside our household as much as possible. I ask all of us to go above and beyond the minimum requirements and to do everything we can to stop spread. Our choices have never mattered more. The choice to be fully immunized saves lives. The choice to reduce close contacts saves lives. Following the mandatory isolation order that continues to be in place, whenever we have any COVID-19 symptoms and if anyone tests positive, saves lives. We have seen similar measures work throughout different stages of the pandemic. These new steps can and will work if we all support them. I ask all of us to also be mindful of the mental health impacts of our current state. We need to be compassionate with ourselves and others to the best of our ability. Kindness has also never mattered more. Please be gentle with yourself and with others. We will get through this too. The more we can do that together, the better we will all be.